Good evening, and thank you for your continued attention after this very long day. Today, I actually hope to generate more questions than I have answers for. I am Lauren Spiker, the founder of 1330 Cancer Connect, a nonprofit based in Rochester, New York, representing the 90,000 teens and young adults who are diagnosed each year with cancer in the United States. That's one young person every 6 minutes who hears the words, "You have cancer." Every 6 minutes, a young life is interrupted, and for far too many, that interruption is forever. 23 years ago, our 19-year-old daughter, Melissa, was one of those young people. Yesterday was her birthday. Despite 2 years of aggressive treatment, Melissa lived an extraordinary, albeit far too short life. I don't have nearly time enough to describe her, so I'll skip ahead to just 3 nights before she died. Late that night, I told her how proud I was of her and thanked her for all I had learned from her. In response, she issued me a challenge, which brings me here before you today. If you learned anything from me through all of this, she said, do something with it, something to make a difference, to make things better. I founded 1330 Cancer Connect to keep the promise I made that night, and we are making a difference. With 2 physical centers in Rochester and Syracuse, we help AYAs, adolescents and young adults, between the ages of 13 and 39 develop a new peer community of others who understand, who get it, something Melissa never had. Our mobile wellness apps and virtual programs help AYAs across the globe better manage the debilitating effects of their cancer. Our clinician and educator workshops help providers deliver more effective care, and our advocacy efforts heighten awareness of the unique challenges facing this group. But much more needs to be done as the incidence of early onset cancer is projected to rise by 31% by 2030. Today, on behalf of the over 5,500 teens and young adults diagnosed each year in New York, I ask you to allocate funds to bridge the gap into which AYAs still fall. Specifically, funding is needed for AYA research, widespread public awareness campaigns, more effective continuity of care protocols, and additional community-based support services like those provided by 1330. I urge consideration for changes regarding insurance coverage and reimbursement, educational and employment protections, expanded tax credits, and perhaps new health-related incentives. For my organization, I ask for funding for a project that we are in the middle of to coordinate services in our community.
Thank you very much.
Thank you.
Assemblymember Gandolfo.
Sure. Thank you all for your testimony, and Ms. Spiker, thank you for sharing your story and what you're doing to honor your daughter's memory and your advocacy. We've seen it in many different areas that the peer-to-peer kind of connection really does help people get through some tough times. You were cut off a little bit during your testimony about the capital, some of your capital needs. Can you expand on that a little bit and how we might be able to help?
Thank you for giving me a few extra seconds. One of the biggest problems that we see with the kids we serve is their challenges are so unique, and they cross so many important transitions in their lifetime that services and programs for them are not coordinated. They fall into lots of siloed pockets, and nobody really understands what their very unique challenges are, especially as they transition from pediatric to adult care. So one of the projects we are currently working on in collaboration with University of Rochester Medical Center and Rochester Regional Health System is to build a coordinated and comprehensive delivery of care service by which our AYAs and their caregivers would have access to providers who understand their very specific challenges. And for that, we have just started preliminary needs assessment. But I think that is the biggest thing that I would ask for from this body is to help us fund a widespread needs assessment, because we really don't know what the unmet needs of our adolescents and young adults in our communities are, because we just have never studied that. So this pilot program that we're starting in Rochester, I would love further support for.
Thank you very much.
Assemblymember Jensen.
Thanks.
Keep skipping him.
We look very similar.
Yeah, very similar. So
At
my
this
question,
hour, you do.
my question is for Ms. Spiker. In your oral testimony, you talked about seeing a increased incidence of cancer for the AYA population. What are the causes for that increase, and what can be done to mitigate those risks?
The first part to that question is we really don't even have a clear idea of what causes adolescent young adult cancer to begin with. And as for the increased incident, which is projected, most of it is lifestyle causes, diet, sedentary lifestyle, perhaps environmental exposures. Some of that projected increase could be because we have done a better job of early screening, so perhaps we are identifying some cancers earlier. But within those suspected causes, there are lots of opportunities for public awareness, for the folks in our age group to be more aware of those kinds of challenges, for primary care physicians to better understand some of the late effects that challenge our kids even post-treatment. So there are opportunities with regard to primary prevention, early detection, and then also survivorship issues that would hopefully try to mitigate some of those risks.
I know in previous conversations you and I have had when we look at the care continuum and where medical research is being conducted, there's a focus on the youngest ages, the middle ages, and elders, but yet there's a dearth of medical research going on with the AYA population. Is that something that, whether it's at the state level or working with our federal partners, we should be encouraging greater amounts of research, especially as we see the increased incidence?
Yeah, absolutely. It wasn't until not too long ago that we thought about teenagers as being different from young children and young adults as being different from older adults. So there has been very limited research with regard to the cancers that our kids get. So there are great opportunities for us as a community-based organization to partner with our academic research partners. Really, I think has the best hope for us to really get at what are some of the issues and how can we best support this group. So we would love support for AYA targeted research.
And certainly right now your organization doesn't receive any state funding for any of your operations. Would even a little bit of allocation help to not just meet the needs of this population in Rochester and Syracuse, but also set new goalposts for how we can affect this population for the better statewide?
Yeah, absolutely. I'm really new to this whole state funding process. So yeah, a little bit would go a long way. Thank you.
Thank you, Lauren.
Yes, Assemblymember Roth.
Thank you. Thank you all for your advocacy on behalf of our state's children. Ms. Spiker, you started to get into this with Mr. Gandolfo a little bit, but just, the continuum of needs that this, a population like young adults with cancer have in terms of, their education, their development socially, I'm sure mental health. So what can the state be doing to help make sure that those needs are met with that population, in addition to obviously the obvious treating the illness, but there's all these other things that I'm sure they're missing in their development.
One primary solution that would definitely help would be provider education. If we could do a better job of educating primary care physicians, both at the pediatric and at the PCP level on the adult side, of the very unique challenges facing our teens and young adults, that would go a long way to help as they transition through different levels of care. With regard to mental health in particular, I oftentimes will have one of our members say, I really need some help because this is really hard, and it's really hard when you're this age. You haven't got your life figured out to begin with, and everything gets turned upside down and interrupted. I would like to be able to refer through some sort of a coordinated network, as I spoke about earlier. I would like to be able to refer our kids, they're always kids to me, to a mental health counselor who understood that kid's unique challenges, I would like to refer them to a primary care physician as they transition into survivorship care, to someone who is aware of the late effects that they might suffer. So provider education is one very, very big area of need.
And your written testimony, you talked about there's a, I guess, increased likelihood for secondary cancers in this population. So what is the kind of, like, how should we be approaching that? Does there have to be more clear guidelines of what else these patients should be screened for after a certain amount of time? And
Yes, and yes. There needs to be guidelines, there needs to be standards of care. Like I said, until recently, we really hadn't even, there wasn't even a discipline called AYA oncology. So we really need to start from the ground zero, especially at the New York State level. We could really kind of set the pace for trying to identify and assess what are the needs and what should we be doing. So the task force that I suggested before would be a really great start.
thank you.